If you've noticed your stool looking different lately and you're not sure whether to worry or not, what I'm about to tell you could literally save your life because certain changes in color and shape are your body's way of screaming for help, and ignoring these signs could mean the difference between catching something early or facing a devastating diagnosis down the road. So pay close attention, because by the end of this video, you'll know exactly what to look for and what to do about it right away. Maybe you've been living with these changes for weeks or even months, thinking it's just something you ate, or maybe it's just part of getting older. But here's the truth that most people don't realize until it's too late. Your stool is one of the most important indicators of what's happening inside your body, and when it changes in specific ways, it's often the first, and sometimes the only warning sign that something serious like cancer is developing in your digestive system. And I'm not trying to scare you, but I am trying to wake you up to the reality that early detection is everything when it comes to colon cancer, rectal cancer, and other digestive cancers that affect thousands of American seniors every single year. My name is Dr. Rebecca Parker, and I've worked as a physician for over 20 years, and today I focus specifically on senior health. And I can tell you from decades of experience that one of the most heartbreaking things I see is patients coming in too late because they dismissed warning signs that were right there in front of them every single day. And that's why I'm making this video, because you deserve to know what your body is trying to tell you, and you deserve the chance to catch problems early when they're still treatable and beatable. You're not alone in this, because thousands of seniors across America are dealing with changes in their bowel movements right now, and many of them are too embarrassed to talk about it, or they think it's just a normal part of aging. But let me be crystal clear with you. Certain changes are not normal, and they should never be ignored, no matter how uncomfortable it might feel to discuss them. And the good news is that once you know what to look for, you can take action immediately and potentially save your own life or the life of someone you love. So here's what we need to talk about today, and I'm going to be direct with you because that's what you deserve. There are specific colors and shapes of stool that are red flags for cancer and other serious conditions. And understanding these warning signs is absolutely critical, especially if you're over 60, because that's when your risk starts climbing significantly. And according to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States, and it's also one of the leading causes of cancer deaths. But here's the hopeful part. When caught early, the 5-year survival rate is over 90%, which means early detection truly saves lives. Now let me explain why changes in your stool happen in the first place, because understanding the mechanism will help you take this seriously and recognize when something's wrong. Your digestive system is like a long processing plant that runs from your mouth all the way down to your rectum, and along this journey food gets broken down, nutrients get absorbed, and waste products get formed into stool. And the color of your stool comes from bile, which is a digestive fluid produced by your liver and stored in your gallbladder, and as bile travels through your intestines, bacteria break it down, and that's what gives stool its normal brown color. But when something disrupts this process, whether it's bleeding, a blockage, inflammation, or a tumor growing somewhere along the digestive tract, your stool changes in ways that are visible and measurable. The shape of your stool matters just as much as the color, because it tells you how things are moving through your intestines and whether there's any obstruction or narrowing happening. And this is where things get serious, because tumors growing inside your colon or rectum can actually narrow the passageway and change the shape of your stool in very specific ways that I'm going to describe to you in detail. And if this is resonating with you right now and you're realizing you've been ignoring these signs, hit that like button, because it helps other seniors find this life-saving information. Let me tell you about a patient I had a few years ago, a 72-year-old man from Minnesota who came to see me after his wife insisted he get checked out because she noticed his bathroom habits had changed over several months. And he kept telling her it was nothing, just maybe something he was eating or maybe just age catching up with him. But she wouldn't let it go, and thank God she didn't, because when we ran tests, we found early-stage colon cancer that was completely treatable. And today he's cancer-free and living a full active life with his grandchildren. But if he had waited another 6 months or a year, the outcome could have been completely different. And that's why I'm so passionate about getting this information out to you. So let's talk about the danger colors first, because this is where most people miss the warning signs. If your stool is black or tar-like in appearance, this is one of the most serious warning signs you can see because it usually indicates bleeding in the upper part of your digestive tract, which could be from your stomach, esophagus, or the first part of your small intestine, and when blood sits in your digestive system for a while, it gets digested by stomach acid and turns dark, almost black with a sticky tar-like consistency, and this could be caused by ulcers, gastritis, or tumors in the upper GI tract. And you need to see a doctor immediately if you notice this, because it means you're losing blood internally, and that's a medical emergency regardless of whether it's cancer or something else. Red or maroon-colored stool is another critical warning sign, and this usually means bleeding is happening lower down in your digestive tract closer to your colon or rectum. And fresh red blood that you see either mixed in with your stool or on the toilet paper after you wipe could be coming from hemorrhoids, which are common and usually not serious. But it could also be coming from polyps, which are growths that can turn into cancer. Or it could be coming from an actual tumor that's already developed. And the problem is you can't tell the difference just by looking, so anytime you see red blood, you need to get checked out by a doctor who can do a proper examination and determine what's causing it. Now here's something that surprises a lot of people. Pale or clay-colored stool that looks almost white or very light gray is also a warning sign, but for different reasons, because this indicates that bile isn't making it into your intestines properly. And this could be caused by a blockage in your bile ducts, which might be from gallstones, inflammation, or a tumor pressing on the ducts. And it could also indicate liver problems or pancreatic cancer, which is one of the most aggressive forms of cancer. So if your stool suddenly becomes pale and stays that way for more than a day or two, you absolutely need to see a doctor right away. From a medical perspective, what's happening inside your body when you see these color changes is that either blood is entering your digestive tract from somewhere it shouldn't be, or bile flow is being disrupted. And both of these situations require immediate medical attention because they indicate that something in your digestive system or related organs is malfunctioning. And time is absolutely critical when it comes to diagnosing and treating the underlying cause. Now let's talk about the shapes that should alarm you, because this is where a lot of people don't realize they're looking at a warning sign. If your stool suddenly becomes very thin, like a pencil or ribbon-shaped, and stays that way consistently for weeks, this is a major red flag because it suggests that something is narrowing the passageway in your colon or rectum, and the most concerning cause of this narrowing is a tumor that's growing inside the intestinal wall and taking up space, and as the tumor grows, it makes the opening smaller and smaller, which forces your stool to squeeze through a narrower space, creating that pencil-thin appearance. I remember a patient, a 68-year-old woman from Florida, who came to me worried about constipation, and when I asked her to describe her bowel movements, she mentioned that when she did go, her stool was much thinner than it used to be. And she thought maybe it was just because she wasn't eating enough fiber or drinking enough water. But when we did a colonoscopy, we found a tumor in her sigmoid colon, which is the lower part of the colon right before the rectum. And thankfully, we caught it early. Enough that surgery removed it completely, and she didn't even need chemotherapy. But if she had kept ignoring that symptom and waiting it out, the tumor would have grown larger and potentially spread to other organs. Another shape warning sign is stool that's consistently hard and pellet-like, almost like rabbit droppings, especially if this represents a change from your normal pattern. And while this can be caused by simple constipation or dehydration, it can also indicate that your colon isn't functioning properly because of inflammation, obstruction, or other underlying problems that need to be investigated. And the longer you go without proper bowel movements, the more waste builds up in your system and the more damage can occur to your intestinal lining. You also need to pay attention if your stool becomes consistently loose or watery, like diarrhea that lasts for weeks, because chronic diarrhea can be caused by inflammatory bowel diseases, infections, or certain types of cancer, particularly those affecting the colon or pancreas. And what happens is that tumors or inflammation can interfere with your intestine's ability to absorb water and nutrients properly, which causes everything to move through too quickly without forming solid stool. Write in the comments, have you noticed any of these changes in your stool? Share your experience, because your story could help someone else recognize their own warning signs and get checked. Now here's what you need to understand about the timing of these changes. If you notice one unusual bowel movement, don't panic, because we all have off days where something we ate doesn't agree with us, or we're fighting a minor bug. But if you're seeing consistent changes that last for 2 weeks or more, or if you see any blood at all even once, you need to take action and schedule an appointment with your doctor immediately. And I know it can feel embarrassing to talk about bathroom issues, but I promise you doctors deal with this every single day, and there's absolutely nothing to be ashamed of. Let me give you the first practical solution you can implement starting today, and this is something that every single senior should be doing. You need to start paying attention and actually looking at your stool regularly. And I know that sounds unpleasant, but it takes literally 2 seconds before you flush, and it could save your life. And what you're looking for is consistency, meaning you're watching for changes from what's normal for you, and everyone's normal is a little different, so you need to establish your own baseline and then notice when something shifts. The simple protocol I recommend to all my patients is this. Before you flush, take a quick glance and ask yourself 3 questions. What color is it? What shape is it? Is there any blood visible? And if you notice anything concerning, take a photo with your phone, because I know that sounds crude, but having a photo to show your doctor is incredibly helpful for diagnosis, and it removes any ambiguity about what you're describing. And doctors have seen it all, so don't worry about showing them a photo. According to recent studies, one of the biggest barriers to early cancer detection is that people wait too long to seek medical help because they're embarrassed or they think their symptoms aren't serious enough. But doctors explain that by the time symptoms become severe enough that you can't ignore them, the disease has often progressed significantly. So catching things early when symptoms are mild or just beginning is absolutely critical. Now here's the second solution, and this one is more powerful. You need to know your family history and your personal risk factors, because these determine how aggressively you should be monitoring and screening for colorectal cancer. And if you have a family history of colon cancer, rectal cancer, or polyps, you're at significantly higher risk, and you need to be getting colonoscopies more frequently than someone without that family history. And if you've had inflammatory bowel disease like Crohn's disease or ulcerative colitis for many years, your risk is also elevated. Your lifestyle factors matter enormously as well, because research indicates that smoking, heavy alcohol consumption, obesity, lack of physical activity, and a diet high in red meat and processed foods all increase your risk of developing colorectal cancer. And the good news is that many of these factors are within your control, and you can start making changes today that will lower your risk. And I'm going to give you specific guidance on this in just a moment. Medicare covers colorectal cancer screenings for people over 50, and in many cases there's no copay, so cost shouldn't be a barrier to getting checked, and you can get screened at any hospital or medical facility that accepts Medicare. And the most comprehensive screening is a colonoscopy, which allows doctors to look directly inside your colon with a camera and remove any polyps they find right there on the spot before those polyps have a chance to turn into cancer. Now let me address something important. A lot of seniors tell me they're afraid of getting a colonoscopy because they've heard it's uncomfortable or the prep is awful. And I'm not going to lie to you, the prep is nobody's favorite day because you have to drink a solution that clears out your entire digestive system. But here's the truth. The procedure itself is done under sedation, so you don't feel anything and you don't remember anything. And it takes maybe 20 to 30 minutes, and when you wake up, it's over and you get to go home that same day, and that minor inconvenience could literally save your life by catching cancer early or preventing it entirely by removing precancerous polyps. From a medical perspective, here's what's happening during a colonoscopy. Your doctor inserts a thin, flexible tube with a camera on the end through your rectum and guides it up through your entire colon. And they're looking for polyps, which are small growths on the intestinal lining. And most polyps are benign, meaning they're not cancer, but some types can turn into cancer over time if they're left alone. And that's why removing them during the colonoscopy is so important, because you're literally preventing cancer before it starts. If you want access to exclusive content, detailed diet plans, and deeper medical advice specifically for seniors, become a channel member where I share information that goes even further than what I can cover in these videos. Now let's talk about the third and most comprehensive solution, which combines screening with lifestyle changes that actively reduce your cancer risk. You need to adopt what I call a gut protective lifestyle that supports healthy digestion and reduces inflammation throughout your entire body. And this is more powerful than most people realize because research has shown that dietary and lifestyle factors can reduce colorectal cancer risk by up to 50%, which is enormous. Here's your simple protocol for a gut protective lifestyle, and I want you to implement these changes starting this week. First, increase your fiber intake dramatically because fiber is absolutely critical for healthy bowel movements and cancer prevention. And you want to aim for at least 25 to 30 grams of fiber per day from sources like oatmeal, whole wheat bread, brown rice, beans, lentils, berries, apples, carrots, broccoli, and leafy greens. And what fiber does is it adds bulk to your stool, which helps it move through your intestines more efficiently, and it also feeds the beneficial bacteria in your gut that protect against inflammation and abnormal cell growth. You can find all of these ingredients at any grocery store across America from Walmart to your local supermarket, and the beauty of this approach is that it's simple, affordable, and based on foods that Americans already know and love. Just maybe not eating enough of them, so let me give you a practical daily plan. Start your morning with a bowl of oatmeal topped with blueberries and a sliced banana. Have a salad with plenty of leafy greens and vegetables for lunch along with some grilled chicken or turkey. Snack on an apple or some carrot sticks with hummus in the afternoon. And for dinner, include a serving of beans or lentils alongside your protein and a generous portion of steamed or roasted vegetables. Second, you need to dramatically reduce your consumption of red meat and processed meats because doctors explain that these foods contain compounds that can damage the lining of your intestines and promote abnormal cell growth. And processed meats like bacon, sausage, hot dogs, and deli meats are particularly problematic because they contain preservatives like nitrates that have been linked to increased cancer risk. So try to limit red meat to no more than once or twice a week and choose fish, chicken or turkey instead. And the omega-3 fatty acids in fish like salmon and tuna actually have anti-inflammatory properties that protect your gut. Third, stay hydrated by drinking plenty of water throughout the day because water helps keep your stool soft and easy to pass, which prevents constipation and straining. And when your constipated waste sits in your colon for longer than it should, which gives harmful substances more time to come into contact with your intestinal lining. So aim for at least 6 to 8 glasses of water daily and more if you're active or if you live in a hot climate like the southern states during summer. Fourth, move your body regularly because physical activity has been shown to reduce colorectal cancer risk significantly, and you don't need to run marathons or join a gym. Simple activities like walking for 30 minutes a day, gardening, swimming, or even dancing in your living room all count. And what exercise does is it stimulates your digestive system and helps move waste through your intestines more quickly while also reducing inflammation throughout your body and helping you maintain a healthy weight, which is another important protective factor. Fifth, if you smoke, you need to quit. And if you drink alcohol, you need to moderate your intake because both of these habits significantly increase your cancer risk. And I know quitting smoking is incredibly difficult, but there are resources available through Medicare and community health programs that can help you. And when it comes to alcohol, the recommendation is no more than 1 drink per day for women and 2 for men. And honestly, less is better when it comes to cancer prevention. Now here's something that might surprise you. Chronic stress and poor sleep can actually affect your gut health and potentially increase your cancer risk because science has already shown that stress hormones can disrupt the balance of bacteria in your gut and weaken your immune system's ability to fight off abnormal cells. So finding ways to manage stress, whether through prayer, meditation, time with family, hobbies, or volunteering in your community is actually part of cancer prevention. And during those long winter months, when many American seniors experience seasonal depression and isolation, it's especially important to stay connected and maintain healthy routines. Let me tell you about another patient, a 70-year-old man from Texas who came to see me after his son noticed he was losing weight without trying and seemed to have less energy than usual. And when I asked about his bowel habits, he admitted that he'd been having alternating constipation and diarrhea for months and his stool had been looking darker than normal. And those symptoms together were major red flags, so we scheduled an urgent colonoscopy and found a tumor in his ascending colon, and thankfully we caught it before it had spread to his lymph nodes, so he underwent surgery followed by a short course of chemotherapy, and today, 5 years later, he's in complete remission and living a full life. But he tells everyone that if his son hadn't pushed him to get checked, he probably would have waited until he felt really sick, and by then it might have been too late. The most important part is understanding that all three solutions work together: regular monitoring and awareness of your stool, appropriate screening based on your age and risk factors, and a gut protective lifestyle that reduces your overall cancer risk. And when you combine these three approaches, you're giving yourself the absolute best chance of either preventing cancer entirely or catching it at the earliest, most treatable stage. If this video has opened your eyes to warning signs you've been ignoring, hit that like button right now because this information could save your life or the life of someone you love. Now I need to emphasize something critical about timing. Colorectal cancer typically develops slowly over many years, starting as small benign polyps that gradually become larger and eventually turn cancerous. And this slow progression is actually good news because it means you have a window of opportunity to catch problems early, but that window only exists if you're actually looking and getting screened. And the American Cancer Society recommends that adults at average risk start regular screening at age 45 and continue through age 75. And if you're over 75, you should discuss with your doctor whether continued screening makes sense based on your overall health and life expectancy. Here's what you need to know about the different screening options, because colonoscopy isn't the only choice, although it is the gold standard. There are stool-based tests like the fecal immunochemical test, or FIT, which looks for hidden blood in your stool and can be done at home with a kit your doctor provides. And there's also a test called Cologuard, which looks for both blood and certain DNA markers associated with cancer and polyps, and these tests are less invasive than colonoscopy, but they're also less sensitive, meaning they can miss some polyps and cancers, and if they come back positive, you'll need a colonoscopy anyway to investigate further. There's also something called a flexible sigmoidoscopy, which is similar to a colonoscopy, but only examines the lower part of your colon. And CT colonography, sometimes called a virtual colonoscopy, uses imaging technology to create detailed pictures of your colon. But again, if anything abnormal is found, you'll need a traditional colonoscopy to remove it. So most doctors recommend just going straight for the colonoscopy because it's both diagnostic and therapeutic, meaning they can find problems and fix them in the same procedure. From a medical perspective, the reason colonoscopy is so effective is that it allows direct visualization of your entire colon and rectum so nothing gets missed. And when polyps are found, they can be removed immediately through the scope using special tools. And those polyps then get sent to a lab where they're examined under a microscope to determine whether they're benign or precancerous or cancerous. And this information guides your doctor's recommendations for follow-up and how often you need repeat colonoscopies in the future. Now let me address some other symptoms that often accompany the stool changes I've been describing. And if you're experiencing any of these along with unusual stool, you need to get checked immediately. Unexplained weight loss, meaning you're losing pounds without trying or changing your diet. Persistent abdominal pain or cramping, especially if it's localized to one area. A feeling of fullness or bloating that doesn't go away. Ongoing fatigue that's more than just normal tiredness and unexplained. Anemia, which your doctor would find through blood work. These additional symptoms happen because cancer or other serious digestive diseases can cause chronic bleeding that you don't see, which leads to anemia and fatigue. And tumors can also block the intestines partially or completely, which causes pain and bloating. And cancer cells use up a lot of your body's energy and nutrients, which contributes to weight loss and exhaustion. So your body is often giving you multiple warning signs, and the more of these symptoms you have, the more urgent it is to get evaluated. I want you to understand something important about the progression from normal cells to cancer, because this knowledge empowers you to take action. Cancer doesn't just suddenly appear out of nowhere. It develops through a series of changes that happen to cells over time, and in the colon, this process usually starts when cells in the intestinal lining begin to divide abnormally and form a polyp. And most polyps remain benign, but certain types, particularly adenomatous polyps, have the potential to accumulate additional genetic mutations over the years that eventually transform them into cancer. And this process typically takes 10 to 15 years, which is why regular screening is so effective, because we can interrupt that progression by finding and removing polyps before they ever become cancerous.